In Vitro Fertilization at the Instituto Marquès. Infertility is an ever-increasing problem in today's society. It is calculated that more than 1 out of every 5 couples has problems in conceiving children. Fortunately, advances in assisted reproduction techniques enable the majority of these cases to achieve pregnancy. However, couples opting for assisted reproductive techniques are generally plagued with doubts. Viewed from the outside, the road seems difficult, complicated and costly, not to mention the anxiety often accumulated following many failed attempts to conceive. Here, in the Instituto Marquès, our ample experience in treating patients following many failed attempts to achieve pregnancy via alternative methods is further enhanced by our empathy towards clients' needs and circumstances. Therefore, our major priority is to provide a warm, friendly service designed not only to make you feel at home, but also provide the emotional support you will require to face the process in a positive manner, calmly and confidently. Clear, extensive information direct from the specialists available in any of our centres will dissipate any doubts and ensure you feel confident throughout the entire process. In the Instituto Marquès, our highly specialised team of gynecologists, biologists, geneticists, andrologists, psychologists and health personnel work in close collaboration towards a common goal. This means that cases are commented in weekly clinical sessions, attended by the specialists of each area, in order to reach the most adequate solution using a multidisciplinary approach. Hence, on combining forces and coordinating our plan of action, we achieve a 90% pregnancy rate in 3 cycles, even in difficult cases such as couples from other centres who resort to our methods following multiple failed attempts. Our success rate is perhaps the reason why so many couples from abroad visit our centre in their desire to become parents, not to mention our excellent results and ample experience in the field, the latest technological advances available in our centres, the short duration of the treatment, and the possibility of being attended to in their own language, thanks to our team of translators: English, German, French, Italian and Russian. In addition, our commitment towards research and the most advanced technology has led us to launch several pioneer programs in Spain and abroad, an initiative that positions us at the forefront of reproductive medicine. Stages of the in vitro fertilization process. In the Instituto Marquès, in vitro fertilization is a highly scientific yet human process, thorough throughout every stage, offering a warm, personalized service, not to mention our commitment to the latest research and technical advances. The Instituto Marquès transmits confidence throughout the entire process. These are the stages of an in vitro fecundation process. Ovarian stimulation. Possible egg donation. Egg retrieval. Sperm collection. The process in the in vitro fecundation laboratory. Preimplantation genetic diagnosis. Embryo transfer. Waiting for the pregnancy test. Difficulties and solutions. Ovarian stimulation. The aim of in vitro fertilization is to stimulate the complete maturity of as many follicles as possible, something that is achieved by administrating a nasal or subcutaneous hormonal treatment, GnRH analogues, which, during the initial stage, suppresses endogenous hormone release of the patient and then stimulates multiple ovulation using another hormonal medication, FSH and/or HMG. Stimulation protocol is individualized for each patient and lasts between 8 and 10 days. During this period, the patient should be administered a subcutaneous injection on a daily basis. Various controls are performed during stimulation in order to evaluate the patient's response. These controls include a blood test to determine estradiol levels, the hormone produced by maturing follicles, and a vaginal ultrasound to observe the number of follicles developing in each ovary and their size. The results of these tests dictate whether medication should be modified and determine when the following control should be performed, 1 or 2 days later. When follicles are between 18 and 20 millimeters in diameter, and the level of estradiol is considered to be adequate, HCG is administered intramuscularly. This hormone triggers final oocyte maturation and ovulation. This injection is the most important, as any errors in timing or misadministration may result in failed oocyte retrieval. Patients may lead a normal life throughout the process. On occasions, the response may not be as desired, in which case the cycle will be cancelled and reinitiated applying another stimulation protocol. Possible oocyte donation. Oocyte donation is indicated in patients who, for various reasons, are unable to produce oocytes capable of fertilization and healthy embryo formation. In this case, the in vitro fertilization process uses donor oocytes and male partner's sperm, following which the embryos are transferred to the receptor. Oocyte donors are young, healthy females who wish to help other women to be mothers. Donors chosen have a high level of intelligence and social consciousness. University students or friends of other donors who have found the experience to be gratifying. Prior to donation, the Institut Marquès screens all possible donors. Candidates are submitted to a gynecological checkup and a complete range of tests, including genetic screening to determine their physical and mental state of health, and also to discard any transmittable infectious or hereditary diseases. Donors are assigned according to blood group, rhesus factor and physical characteristics, and where possible we try to ensure that the donor's physical aspect is similar to the receptors. Receptors have access to information on the blood group and rhesus factor of the donor. However, his or her identity will remain anonymous. In our centre, the embryo transfer procedure is performed using fresh embryos, not cryopreserved, and as such requires excellent donor-receptor coordination and synchronization, a technique offering optimum results. Donor synchronization may be performed using the contraceptive pill or a nasal spray. Receptor preparation is a simple, pain-free procedure, although vital, and as such should be performed with expertise. Once it is confirmed that the patient is pregnant, receptors should continue with treatment for the following 3 months. Misadministration or abandonment of treatment will diminish the receptor's chances of pregnancy and provoke a miscarriage. The high percentage of donors visiting our centres not only allows us to assign donors with similar physical characteristics, but also ensures that transfer is performed within a maximum period of 4 weeks following the first appointment. Oocyte retrieval. Oocyte retrieval is performed in an operating theatre adjacent to the in vitro laboratory. This process is performed on an outpatient basis and only causes a mild degree of discomfort in certain cases. The patient is put under general anaesthetic, following which follicular aspiration is performed by vaginal ultrasonography. The process is short, lasts approximately 8 or 10 minutes and is totally painless. An hour later, the patient is informed of the number of oocytes retrieved and may then be discharged from the clinic. If the patient wants to postpone her maternity, the eggs can be vitrified in order to be used in the future, the moment the patient decides to become a mother. Sperm collection. Once the egg collection has been completed, the sperm sample, obtained by masturbation, is collected from the male in a sterile specimen container. In males with no sperm in their ejaculate, the sperm is extracted directly from the testes. In certain cases, a previously cryopreserved semen sample may be used. For example, when the male lives abroad, in cases of repeated obstruction observed in the sperm collection process, or when he is unable to be present on the fertilization day due to work or personal reasons. At Institut Marquès, we are specialized in the study of the male factor by genetic and chromosomal analysis of the sperm. This study allows us to correctly diagnose the fertility issue and guide the treatment wisely. Techniques such as the fish on the sperm provide the information on the chromosomes of the sperm. The fragmentation study that analyzes the integrity of the DNA, or the meiosis study, which is performed through testicular biopsy. A more detailed explanation of these techniques can be found in the chapter of embryo medicine. If necessary, Institut Marquès has its own sperm bank that can provide a suitable sperm donor to perform the in vitro fecundation. This donor is assigned according to the ethnic and physical characteristics, blood type and rhesus factor. The fecundation in vitro laboratory. The in vitro fertilization laboratory is a key component to the success of every assisted reproduction treatment. The location, design, equipment and culture media are of vital importance to the strict requirements of gametes and embryos cultured in vitro. A highly specialized team work on it. The aim is to treat each embryo individually as a little patient, as your future child. The IVF laboratory of the Institut Marquès is in the forefront of global reproductive biology. It is equipped with advanced technologies such as IMSI, Polaroid and Controlled Atmosphere Booth, Embryoscope, application of techniques such as biopsy of the polar body, removing debris, embryo makeup, assisted hatching, freezing, vitrification of eggs and embryos. In the assisted reproduction laboratory, our biologists evaluate the different stages of embryonic development. They can be grouped into the meeting between the eggs and sperm. 1 day later, the fertilization. 2 days later, the first embryos. 3 days later, the embryo's development. When the oocytes are introduced to the sperm. The oocytes are transported to the laboratory in sterile tubes and immersed in follicular liquid. They are located using a microscope, cleaned and classified according to their state of maturity. Following this, they are kept in an incubator in culture medium at 37 degrees centigrade until insemination takes place. The quality of the oocytes is intrinsic to every woman. Oocyte fertilization may be performed using any of the following techniques. In vitro fertilization consists of introducing the oocyte to the sperm to ensure that the genetic codes merge. In order to achieve this, the oocytes and a specific concentration of sperm, 100,000 sperm with good mobility, are brought into contact in a culture medium and incubated at 37 degrees centigrade until fertilization is observed. An intracytoplasmic sperm injection, or ICSI, consists of inserting a live sperm into the cytoplasm of the oocyte. At present, this particular technique is used regularly when attempting to ensure fertilization. 1 day later, fertilization. The inseminated oocytes are incubated for between 17 and 20 hours, by which time fertilization should have taken place. Should this be the case, the oocyte would show 2 pronuclei, 1 pronucleus for the male genetic code and 1 for the female. The first cycle in the in vitro fertilization process is also diagnostic, hence allowing us to evaluate each couple's fertility rate. Analysis may reveal low fertilization rates or even total fertilization failure. 2 days later, first embryos. The fertilized oocytes then initiate the first phase of cell division. As with people, no 2 embryos are alike. Each embryo has its own characteristics, and at this stage it may be divided into 2, 3, 4 or 5 cells. Furthermore, each embryo offers a different appearance, even within the same cycle. 3 days later, embryo development. On the 3rd day, the embryo should have duplicated the number of cells present on the 2nd. Quality of the embryo. The embryo quality is determined by the number of cells, by the symmetry between them, the percentage of fragmentation, and by the presence of a single nucleus within the cells. We consider that after 48 hours of the egg's fertilization, an embryo with good features displays 4 equal-sized cells and a fragmentation percentage of below 10 to 15%. An embryo with good features at day 3 displays between 6 and 8 equal-sized cells with a low percentage of fragmentation. At Institut Marquès, we consider that each embryo is like a little patient, and we apply individualized techniques in order to help to improve possibilities of implantation and pregnancy. Advanced technologies. IMSI. IMSI is a new generation microscope that allows us to visualize the sperms 10,000 times larger, to distinguish the ones that present the best morphology and are therefore more suitable for fertilization. According to several published studies, IMSI improves the chances of pregnancy and reduces the abortion rate. Polarizer and controlled atmosphere booth. Moreover, our laboratory has other special equipment, such as the Polar AIDE image polarizer, which allows us to observe the most important structures of the egg and to distinguish the best quality eggs. We also have a controlled atmosphere booth in which eggs or embryos are kept in the same conditions of temperature, oxygen, carbon dioxide and humidity, such as they were in the womb. Embryoscope. It is a new generation incubator, equipped with a video camera that can observe at all times the development of the embryo. With this advanced system, we can monitor the embryos second by second without having to take them outside to check their state, thus keeping them in more stable and secure conditions. Techniques. Polar body biopsy. Institut Marquès has an extremely advanced technique to analyze the chromosomes of the eggs and discard those that have abnormalities. This technique is called polar body biopsy and preimplantation genetic diagnosis of the egg. A small hole on the membrane of the egg is performed to remove cells, called polar bodies, that are not necessary for development but give us invaluable information on their chromosomal load. Once we get the result, we can transfer only the embryos from healthy eggs. Fragment removal, makeup. Embryo makeup is one of the techniques used to eliminate cellular fragments that impede embryonic development. It consists of puncturing the embryonic membrane and aspirating the maximum amount of cellular debris. In this manner, we manage to change the appearance of the embryo and restore its pregnancy potential, hence its name. Assisted hatching. As women get older, the membrane covering the embryo, or zona pellucidae, may become harder or tougher, making it difficult, hence impeding implantation. In order to facilitate this process, we perform what is known as assisted hatching, which consists of puncturing a small hole in the zona pellucidae. Freezing or vitrification of eggs and embryos. Embryos that are not transferred and have good chances of implantation are frozen or vitrified. To vitrify means to freeze in an ultra-fast way, preventing the formation of ice. Vitrification is also used to freeze a woman's eggs in order to use them the day she decides to become a mother, storing younger eggs and therefore of better quality. This technique allows us to preserve women's fertility before a treatment for cancer, for example. On the other hand, it enables a young woman to postpone motherhood and have a child of her own genetic material. Preimplantation genetic diagnosis. Conventional assisted reproduction techniques select the embryos to be transferred based on morphological criteria, that is, observing their form and external aspect. However, the chromosomic count cannot be detected under the microscope, as embryos of an apparently good aspect may present anomalies and, as such, lack pregnancy potential. In order to determine whether an embryo has a correct chromosome count, a pre-implantation genetic diagnosis should be carried out. This allows us to evaluate the chromosome state of conceived embryos, hence ensuring that only healthy embryos are transferred to the uterus. Preimplantation genetic diagnosis is a combination of in vitro fertilization and genetic analysis. At Institut Marquès, thanks to our commitment to research and development, we can analyze all the embryo's chromosomes in one cell. This allows us to detect more abnormalities and improve the chances of pregnancy. In advanced maternal age, we can even increase the chances of pregnancy by 3. Analysis. Embryos fertilized in vitro are left to develop over 3 days, considered to be the period required for analysis. 1 or 2 cells are extracted from the embryo by performing an embryo biopsy. However, this does not compromise normal development. Once the biopsy has been performed, the embryo is returned to the laboratory incubator, where it will be kept in an in vitro culture medium under adequate environmental conditions and allowed to continue its development until it is due to be transferred to the patient's uterus. The cell obtained is processed for analysis and submitted to genetic study. A detailed report on the results of the analysis is forwarded to the assisted reproduction team, who, with the clients, decide on the number of healthy embryos to be transferred. Embryo transfer. Embryo transfer is the final stage of the in vitro fertilization process and is decisive in the final results. This process consists of depositing the embryo as delicately as possible in the interior of the uterus. Prior to transfer, the team will inform the patient as to the number of embryos to be transferred. The number depends on various factors, including patient age, embryo quality, previous cycles performed, couple's wishes. Transfer is performed through the vagina, does not require anesthesia and is done on an outpatient basis. Monitored by transabdominal ultrasound, a catheter is gently inserted through the uterus and into the cervix, following which the embryos are deposited in the uterine cavity. Patients should come with a full bladder in order to be able to visualize the trajectory of the catheter. Following the procedure, the patient should rest for 5 minutes and may then be discharged home, where they should rest for a period of 24 hours. In cases in which cryopreserved embryos are used, patient preparation is simple and does not require any previous ovarian stimulation. Patients are only required to prepare their endometrium using estrogens and progesterone. A transabdominal ultrasound is performed to ensure that the endometrium is in optimum conditions, and if everything is in order, we program the transfer. Pregnancy test. Following embryo transfer, the patient may lead a normal life, avoiding any physical effort and following the medical treatment indicated in each case. This is a very special time for both patient and partner alike. A good attitude does not improve pregnancy rates. However, it does convert it into a highly positive experience. For this reason, the Institut Marquès places a psychological department, specializing in couples undergoing infertility treatment at your disposal, offering support throughout the entire process. Difficulties and solutions. Pregnancy is not achieved in a certain number of in vitro fertilization cycles. In cases in which the uterus is considered to be prepared for embryo transfer and yet pregnancy is not achieved, the cause of failure tends to be embryo-related, as a large percentage of human embryos do not have the genetic resources required to allow development. Certain couples show a greater percentage, either due to the age of the patient, in cases where the woman's ovarian age is superior to her chronological, or due to genetic abnormalities present in male sperm. In this event, the case should be re-evaluated and embryonic medicine diagnostic techniques applied. Embryonic medicine. What is embryonic medicine? Embryonic medicine is a multidisciplinary science involving doctors, embryologists and geneticists specialized in embryonic analysis. Its objective is to increase the birth rate of healthy children, free of chromosomal syndromes or hereditary diseases. Embryonic medicine considers each embryo to be a tiny patient. When applied to patients with a history of in vitro failure, it is revealed that many embryos present chromosomal alterations. It is known that these alterations increase considerably as women get older, as they also do in cases in which sperm quality is low. Embryonic medicine also allows us to determine whether these alterations originate in the male by using a series of techniques such as meiosis and FSH to analyze the chromosomal load of the sperm. Most importantly, all these techniques allow us to discover why previous pregnancies have failed and at the same time encourage the birth of healthy children. Embryonic study. What is preimplantation genetic diagnosis? The genetic study of embryos is a diagnostic technique performed on the embryo prior to it being implanted in the uterus. Preimplantation genetic diagnosis provides information on the state of each conceived embryo and only allows healthy embryos to be transferred to the uterus. Preimplantation genetic diagnosis is the combination of in vitro fertilization and genetic analysis. At Institut Marquès, thanks to our commitment to research and development, we can analyze all the embryo's chromosomes in one cell. This allows us to detect more abnormalities and improve the chances of pregnancy. In advanced maternal age, we can even increase the chances of pregnancy by 3. In order to proceed with the analysis, embryos must have been submitted to an in vitro fertilization cycle. The ideal moment is on the 3rd day of development following fertilization. An embryo cell is then extracted using a technique known as an embryo biopsy. How is preimplantation genetic diagnosis performed? An embryo biopsy consists of extracting 1 or 2 cells from the embryo. However, this does not compromise normal development. Once the biopsy has been performed, the embryo is returned to the laboratory incubator, where it will be kept in an in vitro culture medium under adequate environmental conditions and allowed to continue its development. A common fear in couples being subjected to this study is whether the embryo may be damaged during the process. The answer is no. The genetic information is present in each and every one of the remaining cells, and this process does not affect the evolution of the rest. Once the biopsy has been done and the cell has been extracted, it is processed for analysis and subjected to genetic study. A detailed report on the results of the analysis is forwarded to the assisted reproduction team, who, with the clients, decide on the number of healthy embryos to be transferred. Transfer is performed immediately following analysis, normally 4 days after oocyte retrieval. Preimplantation genetic diagnosis increases the pregnancy rate and diminishes the risk of spontaneous miscarriage. Who can benefit from preimplantation genetic diagnosis? Infertile couples. All couples opting for assisted reproduction techniques who wish to increase their possibility of conceiving. This technique is particularly indicated in infertility of unknown causes, patients who have been submitted to at least 2 unsuccessful in vitro fertilization cycles, patients who have suffered at least 2 previous miscarriages, or patients with severe masculine infertility. This technique is equally recommended in patients presenting pathological meiosis or fish in altered sperm, couples with abnormal karyotypes, or women over 37. As with amniocentesis, preimplantation genetic diagnosis is recommended in women of 37+, as the percentage of embryos with chromosomal abnormalities increases and on frequent occasions is the visible cause of pregnancy failure following various in vitro fertilization cycles. In these cases, preimplantation genetic diagnosis for the study of all the chromosomes is the most appropriate technique. Preimplantation genetic diagnosis is also useful in cases in which karyotype or chromosome map alteration is observed of one member of the couple. This is known as chromosome translocation or reorganization. All the genetic information is there, however mapped incorrectly. Consequently, this may result in embryos with chromosomal abnormalities, hence leading to infertility or repeated miscarriages. Preimplantation genetic diagnosis only allows the transfer of well-balanced embryos and discards any affected embryos. Couples with hereditary diseases. Preimplantation genetic diagnosis is particularly interesting for couples presenting hereditary diseases such as haemophilia, cystic fibrosis, Fanconi anemia, Marfan syndrome, Fragile X syndrome, muscular dystrophy, or Huntington's disease, to mention just a few of the most common. In spite of being heterogeneous, all of these diseases have several factors in common. They all tend to be serious, chronic, weakening, and progressive, and treatment is normally palliative, not to mention the difficulties that arise when diagnosing the condition. In addition, they imply side effects, lack of autonomy and ability, and in the most serious cases seriously compromise the quality of life of those affected. Until recently, couples affected by hereditary diseases either had to resign themselves to the fact that they could not have children or take a chance and see whether their offspring developed the disease or not. Today, Preimplantation Genetic Diagnosis offers you access to hereditary disease-free embryos, hence eliminating the possibility that your child may be born with such an illness. In the Institut Marquès, we can perform preimplantation genetic diagnosis on all known genetic diseases at present. To analyze the genetics of sperm could represent a key factor to properly guide a treatment and achieve an evolving pregnancy. In recent years, the team of reproductive biology at Institut Marquès have specialized in the genetic analysis of male infertility. They do this through 3 tests: the study of meiosis, the DNA fragmentation test of sperm, and the fish technique applied to the sperm. A study of meiosis in testicular biopsies. Meiosis is the natural process by which the sperm stem cell chromosome count is reduced by half. It reduces from 46, those normally present in each sperm, to 23 chromosomes. This process often displays alterations and leads to reproductive failure. The origin of these anomalies is as yet unknown. It is supposed that in the majority of cases, the origin is of a congenital nature and developed during the embryonary fetal testicular development phase. Other elements, such as toxic environmental factors, may also lead to this kind of anomaly in the adult stage of life. The fact is that the incidence of anomalies in meiosis is inversely proportional to sperm concentration in ejaculate. A meiosis study involves the analysis of a tiny fragment of testicular tissue. This is particularly indicated in cases in which sperm is not found in the sperm study. The DNA fragmentation test. For a good development of the embryo and fetus, it is of vital importance that the chains of the DNA in sperm are complete and intact. The more breaks in the chain, the greater the chances of infertility, repeated abortions, or in vitro fertilization cycles without pregnancy. Institut Marquès offers one of the techniques that makes it possible to detect the level of broken genetic material of sperm, the DNA fragmentation test, an essential test to detect the origin of male infertility. When damage in the DNA chains is detected, the medical team will recommend a solution in order to improve the prognosis. This could be a treatment with antioxidants, high magnification sperm selection, IMSI, or sperm retrieved directly from the testicles, TISA. Fish applied to sperm. The sperm fish is a technique that allows us to study the number of chromosomes within the sperm. All you need is a semen sample collected in a sterile vial. An abnormal fish study indicates chromosomal abnormalities in sperm. This means that if that sperm were to fertilize the eggs, they could become chromosomally abnormal embryos. For that reason, in this case, we study and identify embryos that are chromosomally normal through a cycle of IVF with preimplantation genetic diagnosis.